This video made for educational purpose only. In this video, we covered the wound dressing, so it might be sensitive for some people, only made for educational purpose. Hello everyone. In this video, I am going to demonstrate how to remove the maggots from the fungating wounds in cancer patients. So, for each and every procedure, hand washing is mandatory before and after every procedure in order to prevent the infection. So, medical hand wash plays an important role in order to prevent the infection. After completing the hand wash, we need to set the tray and the procedure containing a sterile tray. In that, one kidney tray containing gauze pieces, another kidney tray in order to collect the maggots, toothed forceps, straight artery forceps, covered artery forceps, and surgical scissors. 2 plain NS bottles in order to clean up the wound, turpentine oil to remove the maggots. Turpentine oil is used for the purpose of removing the maggots. Why? Because by applying the turpentine oil on the wound area, maggots won't have the proper oxygen supply. So it will come out easily by getting suffocated. It is the main purpose of turpentine oil. Spirit bottle in order to clean the surrounding area, Metrogel to clean up the wound, IV Metrogel, disposable apron, disposable gloves and surgical gloves, and 10 cc syringe to dilute the turpentine oil. So, for starting the procedure after hand wash, we need to wear the gloves. Keep that glove paper in order to keep the pads, and take the 10 cc syringe. Keep the gauze pieces in a kidney tray. First, dilute the turpentine oil with normal saline in 5:5 ratio. That is 5 ml of turpentine oil and 5 ml of normal saline. So, if directly we keep the turpentine oil on the wound, if the mucosa is exposed, the patient may get easily irritated. So, we will cover that diluted turpentine oil on the gauze pieces in a kidney tray. Ensure that it is fully covered with turpentine oil. The total gauze piece soaked in a turpentine oil. So try to cover up the wound with that gauze piece. We need to ask the patient if any irritation is there or any complaints of pain. Before itself, we need to confirm from the patient if any complaining of pain, so that before itself we can give some anesthesia or pain medications in order to reduce the pain. After covering with the gauze piece, wait for 10 minutes or wait until the maggots came out. Remove the maggots by using the thumb forceps or straight artery forceps and collect in a kidney tray filling with normal saline. Observe for some time until the maggots comes outside. In between, you need to communicate with the patient that to ventilate her feelings if any pain is there or any complaints or any mucosal irritation, like that we need to confirm from the patient. After removing the maggots, just cover up the wound with a sterile gauze piece wet with the NS and cover with the sterile dressing pad. So after finishing the procedure, just ensure that the proper wound dressing had done, and try to encourage the patient to ventilate her feelings, whether she is having any pain or not, or any mucosal irritation. Ask from the patient and try to clear her doubts if anything is there. Try to repeat the procedure every 2 to 3 days, so that entirely the maggots will be removed from the wound area. After removing the maggots, try to show to the patient the maggots are removed completely so that she will have the safe and comfortable wound.